Today, it just started raining. I don't know if you can hear it or not, but hopefully you find it soothing and not distracting. It's so good to be back. As you can tell by the title, today we're going to be talking about Nurse why the National Black Nurse Practitioner Association exists. I'm going to give you 7 reasons why organizations like that are essential. If you're new here, welcome. I'm Dr. Kimberly Madison, and a doctorally prepared nurse practitioner, and I use social media to share my journey as a living case study, not only for entrepreneurs, but for those of you who have an interest and passion in dermatology. I'm a nurse practitioner, entrepreneur who specializes in dermatology education and research. I come live every weekend on this YouTube channel. I post articles on my blog, Mahogany Dermatology, every week for the last 2 years. And pretty much every day you can find me somewhere on social media doing a variety of things. And so as you're watching this, we're coming to the close of the year 2024. This is actually the last video, I think this is the last video for the year. So thank you so much for your support. Thank you, all of you. A huge special shout out to my parents who are always in the comments, always leaving little messages, giving me feedback. And to Ebony Eyes, she's been a consistent supporter, not only watching, but leaving comments. It seems like a really small thing, but when you like, share, subscribe, follow, comment, it lets the algorithm know that this information is important. You have to think, if there are millions of videos being posted on a platform, there has to be some way for the algorithm to kind of categorize those. And that's one way it does that. And so when you take the time to do that, it shows other people just like you looking for information like this, that this information is important. So I thank you for taking the time to do that and subscribing. Please let me know in the comments, or you can message me directly through the blog. That link is below, and how I can best support you. So as you're watching this, I've been batch contenting for the last month. Today I'll be doing 3. And so let's get to it. So I do have some goals for the channel in the new year in terms of like how to utilize my time, how to restructure the videos. And so you might see some of that in the next couple months. I really, really want to film from my camera. I haven't taken the time yet to watch the tutorials, but it just seems like it has to be super simple. I've tried it before by plugging it up, and it didn't work. But hold me accountable, because it's a great quality. Oh yeah, hopefully the lighting's not too bad for you all. And it's been kind of gloomy today, so this is the best lighting I'm gonna get without it being too glaring. I did just put on my lipstick, so I'm hoping that it's dried. One trick I've noticed, now I know the old age trick is to use your finger and kind of wipe away the inside. That never works for me. What I have found that works is if I put it on and I don't talk for maybe 10 minutes, it'll give it a chance to dry, and I'll have no problems with it showing up on my teeth. So I might check a few times today to make sure, because I didn't give it the full time to dry. So every week when we go live, we have a main topic. Like today, we're going to talk about the National Black Nurse Practitioner Association. And then I give you updates on other things. So it's like a continuing conversation. I'm super excited today. I'll talk about the fact that I've selected an intern for the Mahogany Telederm Nurse Internship, my first intern. And she actually lives right here in Houston, which is like, the coincidences are amazing. She found out about me because of the algorithm. That's what I'm telling you. So thank you so much. And I'll give you updates on the batch content. I do like to share social media as I'm learning about it, because so many of you are interested. And so I just want to fast track your success. And then we always cover health and wellness, because I believe if you're in the business of caring for other people, you have to be in the business of caring for yourself. So we go over health and wellness. Traditionally, I have used several different resources to kind of talk about spirituality, because that's a big component. We'll talk about my other health, mental and physical. But recently at church, we read a scripture leading up to Christmas. The whole theme that day was really about joy. And this scripture also talked about, and when we heard it, I said, I have to share it with you all, because I just really loved it. And I hope it touches you like it touched me. So we'll get into this. I'll give you some updates about my health and wellness, and then we'll jump into our main topic. You're welcome to join me. So today I'll be reading from John chapter 15, verses 1 through 13. You can also always pause unless you're watching the premiere. Then I don't know if you have that option or not. Okay, so let's get into it. It's titled Jesus, the True Vine. I am the true grapevine, and my Father is the gardener. He cuts off every branch of mine that doesn't produce fruit, and he prunes the branches that do bear fruit, so they will produce even more. You have already been pruned and purified by the message I have given you. Remain in me, and I will remain in you. For a branch cannot produce fruit if it is served from the vine, and you cannot be fruitful unless you remain in me. Yes, I am the vine. You are the branches. Those who remain in me and I in them will produce much fruit. For apart from me, you can do nothing. Anyone who does not remain in me is thrown away like a useless branch and withers. Such branches are gathered into a pile to be burned. But if you remain in me and my words remain in you, you may ask for anything you want, and it will be granted. When you produce much fruit, you are my true disciples. This brings great glory to my Father. I have loved you even as the Father has loved me. Remain in my love. When you obey my commandments, you remain in my love, just as I obey my Father's commandments and remain in his love. I have told you these things so that you will be filled with my joy. Yes, your joy will overflow. Amen. Again, that is from John chapter 15, verses 1 through 13. And one more check on the lipstick. Okay, so let's see. So do I want to hold off and let me talk about my intern at the end, and the batch content. We'll save those two for the end. But let's do the health and wellness. So at the time that you're watching this, I've had my walking pad for maybe, I don't know, you can maybe a month, maybe. Anyway, I love it. I'm on here every day. And so that's helped me so much in just my mental health. Remember, I've talked about seasonal affective disorder, how it impacts me, and how I was seeing if this relocation to Houston was going to make a difference, because, it can have an effect on the weather. So there are some other things about this season and like my childhood that was impacting like how I was experiencing the season, right? But light has been a huge part of that, and moving. So having this walking pad, not having to sacrifice between documentation, working on the business, or working out, taking care of my body, that's helped so much. Like to not have to make that choice, significant mood booster. Being able to stand, being able to move, and to do it so conveniently and economically. So it's my huge recommendation for you that you should invest in that for yourself. They're super affordable, under $200. You can get some that are more expensive, of course, but under $200. I bought a standing desk, and it's always raised. It's never low. And yeah, so I do need to organize it. It looks a mess right now. But we did do some rigging up of some of the cords. I have a million cords here. And so that's really helpful. So we have a nice long power strip on the wall, and then one is attached to my love bug. Shout out to him for his support. He attached it to the table itself. And so and some of them have those options too. So, I mean, that's something you can look for. I think the ones I saw had about two, so that may or may not be sufficient for you. So yeah, that's one thing I recommend for you. So when you're planning out how you're going to use your dollars, think about that. That's one way you can invest in yourself instead of sitting all day. Let's see. And so my mood. So yeah, I have lots of lighting. Of course, it helps this time of year when the trees and all the decorations are up. I wish it wasn't raining so bad. I wanted to go see some more lights before they're all shut down for this season. And I'm already thinking about how I'm going to maintain that light and like, I don't know if festivity is the word, but just that ambiance after the holiday. I did invest in a cute little candle. It's like a LED candle, and it has a timer. And so I want to do some more of that, like around the house, and just some of the lighting, because it helps my mood so much that I noticed. Sleep has been phenomenal. The last week it was really good. I have to be honest. Before that, not so great. Probably back to my old 4 to 5 hours. Even though I'm on sabbatical, you would think I would. I didn't prioritize sleep like I should have. I've taken that opportunity to take advantage of the extra time to do other things. They're working on other projects and stuff. So the last week was good, but it's still a work in progress. But yeah, and so now that I am walking so much and getting like the cardio portion in, still running, I need to replace my sneakers. I decided I'm going to add an extra day just for weightlifting, because sometimes I do want to move and be active, but I don't always want to do anything like rigorous. And so today I was like, you know what? Pretty much every day I'm in the mood to lift weights. And so I decided I'm going to add that on to Mondays, which is one of my long days. I do quite a bit of commuting on that day. And so I tend not to want to do anything else besides walk on the pad just because of how much time that takes. But I was like, you know what? I could do some lifting. So I'll keep you updated on that. And then I heard from my dentist I need to schedule my next appointment. So that will happen. I need to coincide that with my next trip home for the D&B Dermatology NPPA group. Will it be spring? I don't know if we'll call it spring or winter, but our first mixture of the new year. So looking at February, I'll keep you posted on that. And still trying to grow our sister group, Derm-NPs and PAs of Atlanta. We're still trying to grow the DMV group too. Since I've seen you last, I had my follow-up with my dermatology PA, Leah Waller, who I think it's okay to say that she's pregnant because she can't hide it anymore. She'll be going out on maternity leave in March, I think. And so this was our first telehealth visit, our first visit since I moved. And it was great. I basically didn't have any changes. I think I had shared I had my neck's been totally fine since maybe, I guess every once in a while it might bother me, but nothing like hyperpigmentation. Or that I had to like stop certain products. Every once in a while it gets sensitive and I might like just remove my necklace or something like that. So I didn't have any concerns really. It was mostly kind of the update, refilling prescriptions, and talking about her leave, her maternity leave, and when my next follow-up will be, which will probably be after she comes back in the summer. Since I am pretty stable, we have a consistent regimen. We'll probably just do that. And so that was a good appointment. That was actually my very first telehealth appointment now that I think about it as a patient. And so, yeah, it was pretty good. And then, still working on the mental health practitioner. And by working, actually, I haven't done anything on that or women's health or the orthodontist. I still need to do all of those. So I'll keep you posted on that. Okay, let's get into it. The National Black Nurse Practitioner Association, the reason we're talking about it, and while it's really kind of fitting, is my last video of the year, because I just moved to Houston, and they're based right here in Houston. They were founded right here in Houston, and I had the pleasure of meeting them a couple weeks ago when they had, I don't know if it's their annual, but it was their scholarship brunch. And so I met them and my mentee, one of my mentees in person. She just graduated from Texas Women's University, and she got her first job in the NICU. And so we've had a virtual relationship for the last 2 years. And so just all the coincidences. I mean, when I met her 2 years ago, I don't think I had any plans to move to Texas then. I don't remember. But yeah, who would have thunk it? So anyway, I had the pleasure of meeting them. They are a 501c nonprofit organization comprised of advanced practice nurses. It says primarily here in Houston. Hopefully they're watching, get clarification in the comments on what they mean by primarily, if like in terms of their membership, because they are called the National Black Nurse Practitioner Association. So certainly it's not a requirement to live in Texas to be a part of them, but I guess they're looking at who is a member. So I'd be curious about that. So they've been around since 2010. Previously, they were called the Houston Metropolitan Black Nurse Practitioner Association, and they describe themselves as a professional organization for Black nurse practitioners. Their mission, as stated on their website, is to improve. They're committed to improving the public health and welfare of all communities, empowering the advancement of nurse practitioners in their profession, foster social fellowship among members, and serve as a philanthropist to individuals and organizations related to healthcare concerns of the community. Their vision is to reach out to communities across the economic spectrum and provide healthy professional services to meet the community needs. They want to inspire NPs to lead in health and wellness for our communities by promoting outreach education. They want us to take active roles in our profession and enhance community awareness of the availability of an inclusive healthcare provider who visualizes the patient as an individual and treats them with dignity and respect. I think we can all support that. Their founders include Sonia Carruthers, Natasha Clark, Lutricia Harrison, Sheila Weber, Stephanie Brown Elder, Rosalind Taylor, and Rhonda Hawkless, who has since passed away. May she rest in peace. In addition to the founders, they also note the significant contributions of Dr. Lakeisha Green, Nikisha Griffin, Angela Hall, Cheryl Jackson, and Valerie Williams. Please let me know in the comments if I messed up anyone's name or left anyone out. They do have a board of directors. Right now, they're led by their president, Dr. Crystal Thibodeau. She is a family nurse practitioner with her DNP. She was my primary contact and connection with the organization. As I mentioned previously, we had reached out to them on the Melanin Initiative podcast to come on the show and talk about their mission and benefits for members. After I learned so much about the National Black Nurse Practitioner Association, National Black Nurses Association last year, having several of their members on, coincidentally. So I think everyone that I've had on is from the New York chapter, which is a coincidence, except I guess the algorithm can kind of reduce what we consider a coincidence anymore. But anyway, after learning about them, I became really curious about this organization. So I reached out to them so we can bring them on. And because life is busy, it hasn't happened yet. But I also recognized that I was going to be relocating. And I thought, actually, what a better idea to do this in person. So that's the plan in the beginning of the new year, is to schedule something in person. It won't be my first in-person kind of, I've done an in-person kind of interview when my mom had PRP last year with a chiropractor. Shout out to Robel, who helped me make that connection. And so we filmed while my mom was there, and the chiropractor was so kind. He was so, so kind, so respectful, just really nice guy. He made me feel so welcome, allowed me to film. He answered questions. Really, I mean, if you're into content, you couldn't have asked for a better partner. But I've shared before that I was a rookie because I didn't check my camera. The mic, for some reason, the mic didn't work. It's the first and last time that I had that problem. And it was the best footage to date that I've captured, outside of what I have control over in my home. So this will be the second attempt. I've filmed at Alicia's and at the studio for the podcast, but like when someone else is involved, that's not part of the show. This will be my first. And so I do have 4 mics. I have lighting. I have everything. It's just a matter of the logistics of the room. And I think the experience that setting up at Alicia's will lend itself well to that. So I'm just looking really forward to that. And I'll keep you posted, especially I think we're going to try to do it like attached to an event or a meeting just for convenience. And so if that's the case and, you're all invited, I'll let you know in advance so you can be part of that. Maybe we can have an audience. I mean, hey, I'm open to all things creative. So that might be kind of fun. I watched a couple Oprah podcasts this morning, so maybe I'm a little bit inspired too. So anyway, look forward to that. I'll definitely keep you posted. On the website, you can also find the events that they've done in the community. Some of the topics that they've discussed at health fairs and other events include hypertension or high blood pressure, diabetes, heart disease, breast cancer, and they even get involved in legislative activities. Their website, all this information is found on their website, which is through the ENP network. If you're not familiar with the ENP network, and I can't remember what ENP stands for, but a lot of organizations will use it. When I was at the national, and I have too many acronyms in my head. The DC, the national, I don't even know, NPA DC. Now I just know acronyms. Oh, that was the nurse practitioner one too. The Nurse Practitioner Association of DC. When I was a student representative on the board there, that's when I became familiar with the network because they use their website on there. Actually, to this day, and I haven't been part of that since 2021, I think, when I started traveling. So we used to do in-person dinners. They still do them, and I would attend. It was so fun. And I was able to hang on through the pandemic the first year because everything was virtual. But when all that ended and they resumed in-person meetings, I didn't want to I didn't want to not be able to fulfill my commitment. So I stepped down at that time. And but when I was there, and some of this stuff back then, I was, it was just, I just raised my hand and said, I can do it. But today when you hear it, you're gonna be like, yes, that makes so much sense. But it didn't make sense then. But now when I look back, it's like, oh, I've been doing this for a long time. Anyway, on their website, you can find, there's an image in the back, and on top of that is a logo. I designed that logo on some free website where you could design logos, nothing like what we're using today in terms of graphic design and like Canva and the stuff I do today. But back then I was so proud of myself, and I was sweating over the tiniest little details. And the fact that they still have it, honestly, part of me wants to update this. I should update this for them and just give it a gift. Some of the girls who were members with me have now taken on like president, and they've climbed up the ladder. But so my experience with that network starts then, even as a student, and I think as an NP student, that might have been when I first learned about it, because you're looking for preceptors. And so on the website, so even through the National Black Nurse Practitioner Association, you can utilize, when you're creating your website, you can utilize the different features. So one of the features is you can have a provider and preceptor directory. A lot of students go on there, and I don't even know if they sign up to be a member, but either way, they go on there just flooding email to the board about they need a preceptor with all these other thousands of students, right? And so as far as the board goes, at least at the time, the consensus really is like, if you're not a member, if not active member, it's not they don't want to help you, they don't care, but it's like in terms of priorities, they want to prioritize people who are active contributing members. And if they just answer every single student's request for preceptors and research, that's what they become, and it steers them away from their mission. And so, but if you're a member and you're part of it, then you're in the network. You don't really have to beg people through email. You just talk to them at meetings or, via text, because you have their personal contact information. So, I've talked a million times about the benefits of participating in a professional organization, and that's one of them. And really not to wait until you need something like a preceptor. So anyway, so on there, including the National Nurse Practitioner Association, you can see their events, like I mentioned. You can see their picture gallery. They have a career center, so you can find jobs that are posted. You can put your resume on there, and if you're an employer looking for employees, you can post announcements on there. I don't know if you have to pay for that, but you can post events too. So I've posted events for the DMV Dermatology group on there. It does cost money. You can pick, just like any other marketing platform, even like Facebook, where you can post ads. You can pick how much money you want to spend per day, and let's say you pick $5 a day. They'll tell you how much exposure that's going to get you, versus if you spend $100 a day, and then you can pick a deadline for how long you want to do that. And even like a monthly max. And so then it'll stop posting your ad or your job announcement once you reach that mark, particularly if people, if it leads to some engagement, not necessarily clicks on your link, but like maybe they sign up or they register. And so that's when you get charged for the most part. Anyway, so you can go in there and see their career center, the directory, their events. Under their professional resources tab, they've listed information on malpractice insurance, which you can get through the CM&F group. I've heard about this group a lot through the Elite NP podcast. When people are entrepreneurs, you have to do all this stuff yourself. And so, depending on who you work for, you might not have been involved in that. You might have just signed some papers. So yeah, once you're an entrepreneur, or you just decide on your own, you want to have additional support, protection, you might go out and reach and get your own. And so that's it. And typically when you see it like that, like on a group platform, you're going to be able to get the group rate as opposed to doing it by yourself. Anyone who has, well versed in that, you can leave a comment and let us know. But I know through the Elite MP, he has a whole list of vendors, and the whole benefit of that, kind of like what you hear about when we talk about health insurance, is that if, and even like vacations, right? The group rate is usually more economical than going individually. That just speaks to that whole saying about life, if you want to go fast, go alone. If you want to go far, go together. So it's kind of like that. I don't know why I came on this website. I think it was just to see if the picture was still there. And it is. Shout out to them, by the way. And then, so the one, like I mentioned, I told you I met them at the scholarship brunch, and wonderful food. For me, I just had the food off the fruit tray. But I'm a foodie at heart, so I can appreciate good food when it's cooked well, smells nice, it's presented lovely, and it's really thoughtful in the presentation and the selection. So they had fried chicken wings that looked amazing, fried fish, some greens, I want to say sweet potatoes, mac and cheese. I'm telling you, if you can think it, they had it. And everyone around me said it was delicious. Everybody ate everything off their plate. So, and then the fruit tray, of course. Excuse me. So shout out to them for being so thoughtful. So yeah, I want to talk to you about the scholarship. So like I said, they just handed it out. So that application was due November 8th. So if, whenever you're coming across this stuff, especially on your break as a student, this is the best time to look up things and put reminders in your phone, your calendar. Because when the school system, when you're in school, I don't the dog might bark a couple of times with the thunders. Um, you're going to be super busy. And so it's a great time to put those reminders in. You can even fill out the applications because next year when it comes out, it might be the same questions or it might be a few things you need to tweak. And just think about the amount of time that it takes to tweak something versus starting it from scratch. So that's one of my tips for you. So their scholarship is awarded without regard to ethnicity, gender, or sexual orientation. As far as some of the criteria, you have to prove financial hardship, that you're enrolled in an accredited NP or doctoral program. Other factors that they'll take into consideration are membership, academic performance, leadership potential, and your participation in the organization, and like their community programs, and even volunteer hours. Although it's not a stipulation for scholarship awarding, they do encourage all applicants to register and attend at least 3 of their events, including their monthly educational forum or roundtable discussions that happen via Zoom or in person. Additional criteria, you must be accepted and have completed at least 1 semester in an accredited MP or DNP program. Um, NP, because they're for NPs. I wonder if you could have been in a PhD program, be an MP in a PhD program, and maintain a 3.0 GPA. If the funds are awarded, this is the only program that will receive funds on behalf of the applicant. All student members are encouraged to apply. Both members and non-members will be considered. Submit your application, submit official transcript with your university seal, 1 academic reference from your professor, an essay, minimum of 3 pages, maximum of 5, of how you will contribute to the vision and mission of the organization. And then, of course, that'll be your opportunity to identify any financial hardships that may impede your goals. Then you'll provide the mailing address for your school so that they can send the payment. You must be a citizen or a lawful permanent resident. So 7 reasons. So, you might be listening, why do we need, even when I talk about diversity in dermatology education, I provided that list of essential dermatology textbooks for skin of color. Here we talk about DNPs of color, the National Black Nurse Practitioner Association, the National Black Nurses Association. There's, men's, there's like a, there's a National Men's Nurses Association, the Hispanic Nurses Association. There's all these, niche, if you will, professional organizations. You might ask yourself, why do we need to be so separate? Well, my friends, I don't think the goal is that we want to be separate, but when you look around and you see what's already in existence, and if you don't see that you are represented, your needs, your community, if you feel like the barriers that prevent you from gaining access to opportunity are not being addressed by the bodies and entities that are already in existence, then that motivates you to want to create organizations like this. All of us have been part of organizations, national and local. And you might be an active volunteer or member, a board member. You may, voice your concerns, offer your solutions. And when they fall on deaf ears, or when they're not implemented in the way that actually makes a difference, you're further motivated to be a part of organizations where not necessarily like minds. I said, the most important diversity is diversity of thought. But sometimes it's very helpful when people have shared lived experiences. It makes that communication, it makes gaining buy-in a lot easier than having to always prove yourself or defend your choices. And all of us can find where we've experienced this in our lives. Some of us find it more easily and more frequently, but most of us have been encountered it at least once or twice. And unfortunately for some of us, on a daily basis. And so organizations like this exist to advocate for diversity in healthcare. You can look, like I said, when it comes to diversity in dermatology education, we have the Skin of Color Society, which has been around for over 20 years. We have books, there's been presentations, webinars, smaller organizations that have been started since that time, and yet the numbers still show that when it comes to physicians, 3 to 4% are Black and brown. 3 to 4%, that's nothing. If we were talking about your investment, you would look elsewhere. And this is after all of these. There's lots of conversations about what needs to be done, and yet this lack of improvement exists. And so some people are tired of not seeing any action, seeing any change. People want to have a legacy, and some people feel called, like myself, to take everything that we know and try to make a difference. So one of the reasons organizations like this exist is to advocate for diversity in healthcare, to offer support for professional growth, a place where a lot of people experience microaggressions, harassment, disenfranchisement, trauma. A lot of conversations on social media are about trauma that happen in the workplace. So organizations like this exist for that reason. They help to address health disparities, right? My experience and encounter with people who look like me or have similar lived experiences is a lot different. And the rapport I'm able to build, and at the pace in which I'm able to build that rapport, the language I'm able to use is always much faster when that person looks like me and we have shared experience. And we know for a fact that when they're in a room in a safe space with someone who speaks their language, not English, not talking about the English language, talking about the cultural language, it makes a difference in how much they trust you, how much they're going to open up. It doesn't mean that they can't have great experiences and great outcomes with people with different experience or different outcomes. No one's saying that is true. You can say one thing and other things can equally be true. But the data supports the statement. The reason they exist is to encourage education and research. That's my whole platform, is to improve diversity in dermatology education, nursing education and research. One of my good friends, Paula Gonzalez, huge shout out to her. I don't know if you can hear the puppy crunching on his Christmas gift. But one of the things that she advocates for is to have more narrative written text with addressing different medical languages. So when we're talking about clinical research and recruiting patients and participants, a lot of times there's paper that's involved or something they need to read on a computer in a document, and it needs to be in the language they understand. And so there's so many things we can talk about. We talk about increasing inclusivity in research. That's just one of them. And that's one we can all easily do. Remember that Spanish is no longer considered a foreign language. So by just default, it should already be available. It's standard of care. So another reason they exist is to build a supportive community. For people to have a place where they can share their experiences, resources, and solutions. And again, in a trusting and safe space. You can influence policy and leadership. Especially when it comes to policy, if you've never done it, but it makes a big difference and you're interested. What my experience has always been that you just have to say you're interested and volunteer your time, because they will give you everything you need, from the script on what to say, who to contact, give you access to the networks. They show up here, do this, do that, speak on your behalf so that you can continue to grow and have your voice heard. And the main thing that's important is that you share your experience. I can promise you there are legislators whose vote can be swayed by you speaking up, by you writing, and patients' lives who really depend on it. Don't underestimate what you have been exposed to and what a difference that can make. Just because it's part of your job and you do it every day, it's not everybody's job. It's not everybody's every day. And what you have to say really matters, because the patients you care for really matter. And then representation matters. So I basically gave examples about that the whole time. So there's 7 reasons the National Black Nurse Practitioner Association exists. In addition to meeting them and my mentee, I, surprise, got to meet the founder of Diverse Coat Society, Dr. Geraldine Young, another doctorally prepared nurse practitioner. Now, that organization deserves its own episode as well. They actually have a meeting coming up on January 22nd from 7 to 8:30 p.m. Eastern, or 6 to 7:30 Central. So after I attend that meeting, I'll come back and talk about them. So I learned a little bit when I met her, but I'll be able to learn more and be able to talk about it. And ironically, we already followed each other on social media. When I was there, I gave my little spiel, I did my little introduction, and I stood up and told, talking about who I was. And she was like, I know you. We follow each other on social media. And I recognized her organization immediately. So the Diverse Code Society, their mission is that they're a society of diverse educators and healthcare professionals coming together to provide conversations, activities, and support for interprofessional goals leading to educational equity, health equity, and general public safety. Intersectionality and Black Coat conversations are at the core of the group's purpose. The goal of the society is to spread our purpose through visibility and professional association. The logo is symbolic of our interprofessional roles as we wear different coats in society that will intersect to reach educational and health equity. In this professional association, you have the option to wear whatever color coat you want. Historically, the color is white. The foundational color of this group is Black. However, we focus on all shades of the skin, which is a representation of all. Benefits of joining include board membership. They have an advisory membership, leadership opportunities to participate in grants. You can improve educational equity, health equity locally, statewide, nationally, and internationally, and so much more. Dr. Young is, I think she said she was from Louisiana, and really dynamic. She's had her DNP like 2010 or so. And she's been busy. She has a lot on her platform. Can't wait to have her on the podcast so we can learn more. And she can tell you firsthand her motivation and what she's done, which is really phenomenal. So let's see. So like I said, I'm so happy the Mahogany Telederm Nurse Internship application did close on December 15th. And I did select my first intern, and she's going to make her debut on the blog in January. So after she does that, I have talked to her about sharing our experience. We had an interview after the application closed, and as a case study, and she was super on board with it. She understood the value of being able to improve the program for the next intern. And so yeah, once she writes her introductory article and I see how comfortable she is, how much she's comfortable sharing, then I'll share more here. But just super excited to have her on board. Phenomenal background when it comes to not only nursing but dermatology, over 10 years specifically in dermatology. And yeah, she's a wife, she's a mother, also from Louisiana, I want to say. I think she did some time in Florida. Now I've talked to so many people. But yeah, so happy. Phenomenal. For the application, you had to submit recommendation letters, which she submitted three dermatologists that she's worked with in the past. She had to write a personal essay and answer the questions. And so I got a chance to learn about her through that. And then she had to write a paper, and she wrote one on access to dermatology care. Phenomenal, actually. And so our goal is to publish that article. We're going to, make it a little bit more robust, and I'm going to add my contributions so that it can be, so we can have both of us have our name on the article. But yeah, I wasn't expecting that, that it was going to be so good, or that it would sway me to want to focus my attention there. So look forward to sharing that with you, and we'll keep you posted on our progress. We will be doing, I don't know, I think I said monthly updates on the internship from both of our perspectives. So at the end of the year, we have a bunch of content that we can do anything we want with. And of course, I have some ideas on how I'm going to utilize that content. So yeah, continue to follow here, and you can join us on the blog. If you sign up on the contact page, you can be emailed when we have new things to talk about. That's a great place if you're not really living on social media, but you want to stay up to date. I invite you to join the community there. You can check out the virtual preceptor shop. We have how to become a nurse, from Bedside to Dermatology, a step-by-step guide for nurses, the Dermatology Nurse Practitioner Starter Kit, and the Mentorship Guide, which for me is the most valuable book in this shop. I'm still working on the Dermatology DNP Project Ideas book. Right now I have up to 24 ideas that are written and documented, but my list of ideas is extensive. My goal, I don't know if I should tell, but my goal is I think I can get 50 ideas in that book. So stay tuned for that. And yeah, I've had some really productive meetings since I talked to you all about projects in the new year. So looking forward to that. and just opportunities just to continue to support you all in your journey and to do what I talked about today by increasing access to dermatology education, particularly when it comes to skin of color. And there's just people coming out who are so supportive of that and wanting to join, which is amazing. As we close out in the new year, I just encourage you to not squash your dreams. You're welcome to join us at the DMV Dermatology NPPA group and Derm P's and P's of Atlanta. Shout out to Allie. We were able to catch up after her semester ended on a high note, I might add. If anybody knows about time management, it's her. Just continues to just show me how, what a bright future she has. Certainly, her parents did a wonderful job. And, now that she's an adult, she certainly deserves a lot of that credit too. But super excited about what she has coming up. She'll be doing some shadowing at a derm office here. One of the MPs there is a new DMP, actually. And so, and they're really excited about growing their practice and social media. And so I think it's just a great place for Allie to, get her feet wet, and looking forward to, watching that as an entrepreneur, watching how they grow the group, watching how they grow the practice, and seeing what ideas we can offer. And the fact that they love being on social media, that doesn't hurt. Maybe I'll even get to meet the MP that she'll be shadowing. That would be phenomenal, actually. So just that everybody's so open to sharing and being kind of public helps a lot, helps all of us. You can register for the Diversity in Dermatology Conference. We'll be in Louisville, Kentucky, staying at the Marriott downtown, March 27th through the 30th. I've dedicated a whole episode to the conference in the agenda, so you can check that out. Remember, all my videos, for the most part, since, I don't know, at least most of this year, are in the live tab because I go live. So that's where you'll see them. And yeah, I think that's all we have. In terms of batch content, so yeah, I still go live on the laptop. When I go live, I select private, and then I schedule it for whatever time and date I want. What I will say is that, so no, I don't think anyone can see me right now. Oh, I was going to check my phone while I was talking to you all to see if you can see. Is that even though I say I film it today, let's say today's a Saturday, and I want to schedule it for 2 weeks from now, when it goes live, it's going to show that it was filmed 2 weeks ago, even though it just became live. Now, I Googled, and it said that won't matter in terms of your success in terms of the algorithm and stuff like that. It says it won't matter, but it looks weird because it looks like it's been up for 2 weeks and there's no views. So if that bothers you, then maybe this isn't a good option for you. But if it doesn't bother you, then maybe you'll be okay. I'm just going to check and see if people can see me right now. No, they can't see me. So that's weird. So yeah, right now it looks like I posted 3 videos 2 weeks ago. And those were all the videos I made at one time, like I'm about to do right now. I'm going to do 2 more after this. So yeah, that's the update on batch content. It's been really helpful in terms of saving time and things like that. But I think there's a lot of value in doing something every day, like going live on social media, writing. It really helps hone your skill, not only the skill, but also like the pace and your progress, just how quickly you can have that happen. But it also can, when you do kind of give things a little bit of time, it can also help you perfect things and refine them and become more focused. So there's benefits to both. I've shared my experience with you, and so I'm going to continue to batch content for now. And my sabbatical ends later this week, and so I guess you'll see me again. It's funny, I've actually been wondering if I even want to go back on Instagram. The social media tool that we use right now, it has like rules, like you can't link it to like a personal page, it has to be linked to professional pages or one at a time. And so right now I have it, which actually maybe I should stop. I know I have to look at that again, see if I can make any changes with the setup, because if not, it's not really working for me right now because it only posts to LinkedIn. It can post to YouTube, Pinterest, and I can't post it to Facebook because I have my business posted there. So I could make some changes, I guess, if I want to. But anyway, in the next couple weeks, I'll make a decision about that. We've also played with TidyCal, which I'm kind of on the fence about too, because it didn't give me the option to have different branding. And so I need different branding for me as well as for the podcast. And so it's more important for me to have that because you can put in options to like for fees, if you want to charge for your time. You can't do that on Google. For Google, you can use a calendar and you can have people schedule time with you. But if you want to like set up consultation calls for a fee, then you can't use Google. You need a different platform. And so we signed up with TidyCal because we thought we would have that option. And you can create different types of like meetings people schedule with you, but the branding looks the same. And so I don't like that. And so I'm going to find something else. So that's the updates in terms of like social media. I am going to do a video soon on like starting a business and talking about kind of these things, these like management things, because, you talk about starting a business, you think about the idea. But as someone said recently, they were like, this thing that you love, this tree that you love, once you become an entrepreneur and a business owner, you don't do this anymore. You're a business owner, you're running the business. And then this is just something that you look forward to doing one day again. And she couldn't have been more true. And so I just want to talk to you about that if you're thinking about starting a business, so you can just be better prepared. So look forward to that. Thank you so much for watching, and I'll see you next time.